Everyone, Aiken Augusta Holistic Health has been here in the CSRA since 2007. Dr. Robert Pendergrass leads a multidisciplinary team that can provide new perspectives on your health and medical concerns. Located in North Augusta, the Integrative Medicine practice offers a variety of services, including a holistic health consultation, health and life coaching, acupuncture and oriental medicine, and a dietitian and nutritionist. And we're really happy today to have Dr. Pendergrass here in the studio with us. And I guess the best thing to say is that you are an integrative medicine specialist.
Right. So I got training in integrative medicine in 2004 and 2005 at the University of Arizona Center for Integrative Medicine. I don't like to think of myself as a specialist because I'd like to think that integrative medicine in the long run is just going to be viewed as good medicine that everybody practices rather than a specialty silo unto itself.
So you would like to see, ideally, this whole mind-body wellness concept in regular conventional medicine practices?
I would, and I think it's because that's what people recognize intuitively. I think most people recognize that human beings are more than the sum of their laboratory tests and prescriptions. And
that's a great line. That's great.
And that a mind-body-spirit approach that takes into account the whole person and has time to explore the impact of all of those things on health is really what people need, rather than simply reducing human health to here's your prescriptions and list of drugs and list of tests. That's what often physicians are forced into, given our current reimbursement mechanisms and a broken healthcare system.
Right.
But I don't think doctors are any happier about it than patients are.
So that's very important to you.
It is.
And so that's what one thing happens with your holistic health consultation. Is that the time frame you like for that?
Yes, I'm going to take probably on average an hour and a half with a patient during an integrative medicine consult, and I may even spend more time after that. In fact, I usually do, in reviewing and thinking and reading and coming up with a list of holistic recommendations for approaching health from a variety of viewpoints.
I think that you're sort of touching on something that is frustrating for a lot of us when we go to the doctor. You feel like you want to play catch up. You feel like you need to get the doctor up to speed with everything that's been happening, and I think that it's not set up that way so many times. They're going to treat what the specific thing is.
Sure.
When do people wind up calling you? When they get to that kind of a point and they think, oh, there's just so much going on here, or maybe this doesn't work for me, I'm out of options. Tell me who the typical patient is that you talk to.
So the usual, maybe stereotypical patient who's going to call would be somebody who has a bent or an inclination toward natural medicine in the first place, who wants to look at those sorts of options before or even in addition to conventional medical approaches. We also have people who may have chronic symptoms, say chronic headaches, chronic abdominal pain, fatigue, poor sleep, anxiety, all those things that may not have been addressed well by the conventional medical approach. The sort of patient who says, well, the doctor says all my tests are fine, but I know I'm not fine.
Yeah.
I feel bad. And we can take the time to explore that in depth and discover what are those mind-body connections, addressing nutrition, addressing natural medicines, addressing supplements and herbs that may be a way to look at health in a way that's not broken down into parts of procedures and pills.
I love the way that you speak about it. I think that is so interesting and enlightening, and it does feel like that's where we are moving as a society.
I hope so.
Dr. Pendergrass has also written a book called Breast Cancer, Reduce Your Risk with Foods You Love. It's received critical acclaim from experts all over the country. You can get it on Amazon. And this book sort of epitomizes that holistic approach that we've been talking about in terms of health and well-being.
Right, and I also want to emphasize that even though I wrote a book on breast cancer prevention that I'd really love mostly for teenage girls to be reading, while prevention is still so effective, it's still an effective way to look at survival, but it is not intended at all to be replaced